Hello and welcome to Dr. Ankur's Dental Lectures. Today we are going to talk about general anesthesia. This is not going to be a complete pharmacology of general anesthesia, but only the important topics which concern the dentist's everyday practice. Before going to general anesthesia in particular, let's talk about the history of GA. General anesthesia was first demonstrated and started by William T.G. Morton. Morton was a Boston dentist and a medical student, and he first demonstrated the general anesthesia at an operating room in what is now known as the Ether Dome at Massachusetts General Hospital in Boston. Though ether is no longer used in any of the modern day anesthetics, but it was a breakthrough. Now, an important thing that we need to know about the general anesthesia is the 4 stages of GA. So there are 4 stages of general anesthesia. The first stage is known as stage of analgesia. Now it starts from beginning of anesthetic inhalation and it lasts up to the loss of consciousness. Here the pain is progressively abolished. Patient remains conscious in this stage and he can hear, he can see, he can feel, but it's like a dream state. The reflexes and respiration, they remain normal. So it is difficult to maintain and use is limited to short procedures only. The stage 2 is known as stage of delirium and excitement. This starts from the loss of consciousness and it ends at the beginning of regular respiration. First of all, the patient gets excited and he may shout, he may struggle or hold his breath. Muscle tone, it increases and jaws, they close tightly. The breathing gets jerky and there may be vomiting, involuntary micturition during this stage or defecation. The heart rate and BP may raise, pupils dilate at this stage due to sympathetic stimulation. Now, it's commonly seen that the patient holds his breath during this stage. Potentially dangerous responses can occur. Now, in modern anesthesia, this stage is completely omitted because of pre-anesthetic medication and with newer pharmacological advances which cause rapid induction and other things. Now, the stage 3rd is the stage of surgical anesthesia. It extends from onset of regular respiration to cessation of spontaneous breathing. Now, there are 4 planes of stage 3. 4 planes. So these are the things that we should remember. So there are 4 stages of general anesthesia and in stage 3 there are 4 planes. Plane 1 is roving eyeball. Plane 2 is loss of corneal and laryngeal reflexes. In plane 3 the pupil starts dilating and the light reflex is lost. And plane 4, the intercostal paralysis occurs, shallow abdominal respiration is seen and pupil is dilated. Stage 4 is the stage of medullary and respiratory paralysis. Here there is a cessation of breathing, failure of circulation, and finally it leads to death. Pupils are widely dilated, muscles are totally flabby. Pulse is not felt and the blood pressure is really low. So those were the 4 stages of anesthesia. All these stages, as I have already told you, do not exist in modern anesthesia because of IV as well as inhalational anesthesia which is used now, as well as due to preoperative and postoperative drugs, etc. So in modern day anesthesia, these 4 stages as such, they do not occur. Now, next we come to what is the classification of general anesthetics. So there are 2 types of anesthetic. The first is inhalation and the second is intravenous. So in inhalation anesthetics, there may be of 2 types, gas, let me just take it a bit downwards, gas and volatile liquids. Now, example of gaseous inhalation anesthetic is nitrous oxide, and volatile liquids may be ether, halothane, enflurane, isoflurane, desflurane, etc. Now, in IV anesthetics, intravenous, there may be inducing agents, for example, thiopentone. So, inducing agents, for example, thiopentone, methohexatone sodium, propofol, etc. There may be benzodiazepines, which are slower acting anesthetics, for example, diazepam, lorazepam, midazolam, etc. Then there may be dissociative anesthesia, example is ketamine, and the 4th part of the classification is neurolept anesthesia, analgesia. Example is fentanyl. So that is about the classification of general anesthetics. Let's revise it once again. It may be inhalational or intravenous. In inhalational, it may be gaseous or volatile liquid. Example of gas is nitrous oxide, and of volatile liquid, ether, halothane, enflurane, isoflurane, desflurane. In case of intravenous, there may be inducing agents like thiopentone, methohexatone, propofol, etc. Benzodiazepines, for example, diazepam, lorazepam, midazolam. Dissociative anesthesia, example, ketamine. And neurolept analgesia, example, fentanyl. So that was about the classification of general anesthesia. Now, coming on to the complications of anesthesia. The complication of anesthesia may be ones that occur during the anesthesia and after the anesthesia. So, complications. Complications may occur during anesthesia, during and after anesthesia. So those occurring during anesthesia may be respiratory depression, there may be cardiac arrhythmias, laryngospasm, asphyxia, delirium, convulsions, or the patient may become aware of the things. There may be salivation and respiratory secretion sometimes. Sometimes there may be a fall in blood pressure. Now, after anesthesia, there may be nausea and vomiting. Organ damage may occur, for example, liver and kidney failure. Sometimes pneumonia may occur or persisting sedation may occur. So these are the complications of anesthesia. Coming on to the final topic for today, that is pre-anesthetic medication. Now, these are the drugs which are usually given before administering an anesthetic agent to make anesthesia safer and more agreeable to the patient. So it causes, of course, analgesia. It's aimed at causing analgesia, amnesia sometimes, relief of anxiety, and antiemetic effects, etc. Now, usually the drugs used as pre-anesthetic medication are sedatives, for example, diazepam, opioids, example, morphine, anticholinergic. Anticholinergics, H2 blockers, and antiemetics. So, these are the commonly used drugs in pre-anesthetic medication. Now, what the protocol which usually follow during anesthesia is, first there is a preoperative assessment. After that, we give a pre-anesthetic medication to the patient, after which we usually use thiopentone or propofol for induction, muscle relaxant, then we do intubation, and then we give nitrous oxide plus halogenated hydrocarbon, and finally we withdraw the drug and wait for recovery. So we have classified the drugs which we use for general anesthesia. We have talked about the stages of general anesthesia. Then we have talked about what is the pre-anesthetic medication with a short discussion on what may be the complications of anesthesia. And finally, we've talked about the protocol. So that's what we need to know in very brief about general anesthesia. I hope you found today's lecture interesting and informative. You may give your feedbacks at our website www.dentallectures.net. You can also give the feedback at my email ID. Also, if you liked this lecture, please subscribe to my YouTube channel and follow us on Facebook. Thanks for the lecture.